Afternoon, we're here today to talk about our emerging transition in the ongoing efforts involving COVID. Here's what I know during this period of time. We have not changed, but the virus has changed. So now we are entering a transition period, and we're here to talk about how to make that transition going forward starting today. Before we talk about what the next phase of this journey will look like, I'd like to address where we are right now and why this transition we are beginning is appropriate. You know, they say the last mile of any trip is the most challenging, and that may be the case here as we come out of the pandemic mode of dealing with COVID. I want to show some headlines around our state that have been very gratifying the last week or so. COVID hospitalizations are declining, and now on both sides of our state. That's great news. We know how hard our hospital workers have been working, and we appreciate their incredible diligence during this period of time. They're going to have continued work as they catch up for other measures, so we need to stand with them in the coming weeks. So these are headlines we like to see. Now, based on trends we're seeing in other countries and states that are further along in the Omicron wave, we fully expect declines to happen here as well, which is also great news. That's why we will no longer need the National Guard. That mission will be ending soon, and why we are removing our requirement that non-elective surgery be postponed. That'll be removed on February 17th. I want to talk about where we are in this curve, and I'd like to show you the models that our Department of Health uses. And we have modeling. I'll show you the graph here. You'll see on the left, of course, that's when we started the COVID journey. We had multiple waves, and of course, the highest wave by far has been the Omicron wave. This shows the hospital data. And you'll see we're just coming over the peak and starting down on February 9th. And now we have projections of a very steep decline leading to, we hope, extremely low numbers by the first week in March. Now those are projections. They are not absolute certainties, as we know. But the very good news is that we believe this wave has gone up like a rocket, and it's going to come down like a rock. And in fact, that is, we're starting to see that now in the state of Washington. I'd like to show also why we have confidence in these predictions. And I want to show you a graph of other countries. And this is why we have confidence that we will continue to see a rapid decline in COVID. This chart shows the experience of the last couple months, or even further than that, of multiple nations around the world. And you'll see obviously the multiple waves coming up to the Omicron wave at the end. But then you'll notice virtually every country has experienced the same thing, which is a very rapid decline in COVID in the last couple of weeks compared to a very rapid increase in the preceding few weeks. This is true for virtually every country that we have data from around the world. This is what gives us confidence that these numbers are going to go down dramatically in the next several weeks. And we're happy to be on that downward slope in this regard. Now, hospitalization rates are still higher today, of course, than in any other time during the pandemic. So as for today, caution is still advised. It remains our best defense. But Omicron clearly has characteristics that will allow us to lift mitigation measures with the weeks to come rather than months. So I'm pleased today to say we are lifting our outdoor masking requirements by February 18th. But today is not the day to lift all of the masking requirements. We are obviously having conversations and an intensive review of what day it will be and when we can do this. It is no longer a matter of if, it is a question of when. And I expect to share that date next week with Washingtonians after we have another week or so of data to give us even a higher level of confidence of where we're going to be sometime in March. Now, as we get ready for this transition, and it is a transition, and all transitions, of course, are challenging for us, change is hard, I want to say two things. First, our decisions in the next several weeks will continue to be based on public health. Public health is our pole star, and we follow it. And the second thing, I want to directly address the millions of Washingtonians who have quietly done so many things in the last 2 years to keep them safe and to help our community arrest this disease. To those families, I say a big thank you for what you've done. You knuckled tight, you didn't give an inch, you kept the faith, and has made a huge difference on how our state has done. As you know, we have saved thousands of lives in the state of Washington because we have been responsible and because we have followed science. And we are going to continue to do that. And fortunately, the science now allows us to move to a new transition, a period of lifting these requirements. So as we move forward, we are not going to desert each other. We are not going to be stampeded by any political force. We will not be stampeded with other states, what they might do. We are going to make decisions for the public health of Washingtonians based on the science here in our state. And so the day is coming fairly soon when we do not have a broad mask mandate for indoor public spaces or for our schools. And we're going to do that by following the science to make the right decision. We don't make decisions based on social internet culture, wars over masks. We did not require masks for symbolism. We required them because they work. And now we believe we're in a place to transition to a different state. I agree with the CDC that today is not the day to totally eliminate masks, but it is a day that is rapidly approaching. So whatever this off-ramp of the pandemic response looks like, and when it does come in the near future, I want to reassure people that we will be having your safety in mind. I have had on my shoulders the safety of 7 million Washingtonians, and I intend to keep it there. We're going to make a safe transition when it's time. That time is coming soon, in the next few weeks. And as I said, I will have a date hopefully next week when we have a little more data to make that specific designation. Now, when we do that, I do want to assure people as well. People will be entirely free to continue to wear masks should they desire to do so. And we are going to respect people's ability and willingness to do that all the way through. I want to give a legislative update. Here in Olympia, the session is halfway over, and I'm extremely happy about some progress made on transportation. The Move Ahead transportation package has been announced, and I believe it is a tremendous step forward for all of our communities to ensure safe, reliable transportation options for millions of Washingtonians. This package recognizes the need to do multiple things to reduce emissions that contribute to climate change. I'm proud to say that $5.4 billion of the revenue package comes from the Climate Commitment Act, which is the best cap and invest program in the United States. And I think it's fantastic that we are simultaneously maintaining and improving transportation and using those funds to improve transportation options on how people get around in the state of Washington. What a twofer. This package will help replace the I-5 bridge over the Columbia River. It's going to keep our legal commitments to remove impediment to fish passage. It's going to continue work on high-speed rail. And I think we owe a huge debt of gratitude to the two leaders who've been responsible for this. Jake Fye in the House, Transportation Chair, who has been a stalwart for years, and much of the work he's done to build the support, the foundation for this. He's been at this for years. And I want to thank Mark Elias in the Senate, whose new leadership and fresh leadership has really bring to fore a fantastic package. So I'm really appreciative of their efforts, and I commend the legislature to get this job done. I'm also pleased to see our efforts to address homelessness and our housing shortage. Those measures are moving forward in the legislature. They are among the most urgent needs this session. And I want to thank Senator Kudeher for her work on our right-of-way encampments progress, and Representative Bateman for her work on middle housing to provide more middle housing options for Washingtonians. I think our middle housing bill has spurred a very important conversation in our state. We have to have more housing to adapt to the burgeoning population in our state. It is absolutely necessary, and I look forward to their success. With that, we have Lacey Fairback here with us today to answer any questions, and you may fire when ready, Gridley.
Up first, we'll go to Rachel with AP.
Go ahead, Rachel.
Governor, the White House today said it's working on new guidelines on next steps in the pandemic, but didn't offer a timeline. So how much of your decision-making is tied to what the CDC is recommending? And is there any input or guidance from them that you've sought but haven't yet received? And then also beyond the masking requirements, will next week be when we hear about when other restrictions in place might lift?
Well, yes, next week it is my intention to give Washingtonians a date where the mask mandate for public indoor spaces and the mask mandate for schools would be lifted. And I believe we will be in a position next week to be able to announce that date. I think that would be helpful for Washingtonians to have a goal and helpful for them to do whatever planning is necessary for that transition. So that is my full intention. And as I've said, I feel confident moving in that direction based on all of this epidemiological research we have that is confirmed by what's happening internationally. The CDC, we listen to the CDC intensely. I think that they will be thinking about making some changes. It is my suspicion in fairly short order, I suspect, generally in the direction that we are suggesting. So I think what we're saying is consistent with what CDC said today, which is this is not the day today to change the mask mandates. And of course, they don't have a mandate, they have recommendations. But we ought to be thinking about when that is, and I believe in our state, and may vary from state to state. Every state's different. We're a little bit later than many, if not most of the other states that are earlier on the wave. So New York, New Jersey, they hit their peak a little earlier than we did. So we're making decisions based on the epidemiology of our state, not in other states. And so having a state approach we think is the right way to go, and that's what we intend to do.
Next question comes from Joe with
The Seattle Times. Go ahead, Joe.
Hey, Governor, I want to get your reaction to State School Superintendent Chris Reichdahl calling for masks to be optional in schools, or for that decision to go to local districts. But why not do that today?
Well, he's calling for it to be done today. I talked to the superintendent yesterday about this. He's not suggesting that happen today. He is suggesting that happen in the near future, and that's exactly what we're doing. So we're doing it because we do believe we do want to see a little more data to be able to pick the right day. If I pick a day today, it might be later than if I pick one next week when we see the data come in that's even an accelerated rate of decline. So we thought that makes sense. And I think that's consistent with what Chris and I talked about yesterday. So I don't think there's any space between us in this regard. As far as decision making, at least at the moment, I think, if local health departments, we would not change or remove their ability to make their own mask mandates if they wanted to. So our proposal would not be to change that, although I haven't seen an indication that they would implement that, at least at the moment. But no, I think we're on the same page with Chris in this regard. I think there was some confusion yesterday about that, unfortunately, that he was not calling for a removal today, but it is in the near future. And I agree with him on this. I agree with him on this because of the epidemiological evidence, but also because, teachers and students have been doing a great job with masks, but if we can eliminate that inconvenience safely, we should do so. And that's what we intend to do in the weeks to come.
Up next, we'll go to Laurel.
Laurel with the spokesman review. Go ahead, Laurel.
Hi, Governor. Two questions. On the proclamation for non-emergent procedures, I believe that allows you to end it earlier than the 17th. And some hospitals have said that they're ready now to kind of start those back up. So why not end it earlier than next week? And secondly, do you imagine the announcement next week will be statewide, or are you considering a phased in or regional approach like we did about a year ago?
Well, we intend to have a statewide. This will be removed statewide. We do believe that's the right approach right now. We believe that having a statewide approach is the right one because if a hospital does have room, and that's hospital A, but hospital B is overwhelmed, we want B to be able to send patients to A. So we want a statewide system here, and we don't want hospital A doing cosmetic surgery while hospital B doesn't have a place to put their patients. So for another week, we think that makes sense to continue this. But I'm happy that this is a relatively rapid, and it was relatively short period of time to have those restrictions on elective surgery. And that was requested by the hospitals, or at least they agreed to it because they have this problem. So I think it's the right decision.
Next question comes from Austin with Northwest News Network. Go ahead, Austin.
Hi, Governor. Can you explain, there are county level masking requirements, it's my understanding. There's also a workplace masking requirement from LNI, and then there's a federal masking requirement for public transit. If you rescind or set a sunset date for the state masking requirement, which I understand is actually a secretary's requirement, how will this work in all of those patchwork settings? Like, what will you be announcing and what will that cover and what won't be covered?
It is our intention in the upcoming weeks to remove the state mandate. But as you've pointed out, there are other systems that have requirements. So we will not strip local health districts of making decisions for their local community. We don't intend to strip them of that right. Now, I suspect I would be surprised if local districts would reinstitute that themselves, but it might be a possibility. It would be, at least at the moment, not our intention to reduce their authority in that regard. As far as the federal public transit, as you know, I can't change that. And if the federal government continues to impose that mandate, that'll be something that, Congress or the president has the authority to change. I would not. On the LNI issue, we really don't have an LNI specific requirement for specific masking requirements. There really isn't one right now for LNI. There is a general responsibility to be careful with our employees. So we don't think would be a conflict with any of our LNI provisions. But there is a general, obligation to pay careful attention to employee safety. I will also note that this would not remove the ability of businesses or nonprofits to make their own decisions about what they expect of their employees in their own workplaces. They would be free to make those decisions, and it's simply that we would not be mandating them. So you bring up, I think, an important issue that I wish this was simple, fighting pandemics. It's not simple because we have multiple jurisdictions. But I believe the state of Washington can now start to move forward, making this transition.
Next question comes from Jerry with the Everett Herald.
Go ahead, Jerry.
Thank you, Governor. Two questions. The first can you clarify on the outdoor event, is that any event outdoor, or is that related to events of a certain minimum or maximum crowd size? And then I had a question on transportation. Do you agree with and support the shifting of $2 billion from the general fund for the transportation?
I think that the legislators are making a responsible investment from the general fund in transportation. It's largely one time. fitting our one-time circumstances. So I think it's a responsible thing to do. And I appreciate all the legislators willing to make that investment. Removing the outdoor, we basically are removing any of the restrictions regarding outdoor activity. And I'm going to double check that to make sure there isn't some part of this that I've missed. Lacey?
Hi, Governor. So currently there's no requirement generally to wear masks outdoors except at large events of 500 people or more. That is what will expire next week, as previously announced by the governor in the press conference.
Next question comes from Drew with King 5.
King 5. Go ahead, Drew.
Good afternoon, Governor. Wanted to change the topic a little bit. A lot of tsunami talk lately. There is a bond measure out at Ocean Shores that appears that it's going to fail. Does the state need to do more to build some of those structures as opposed to relying on federal funding or local funding? Should that be something the state should make more of a focus right now?
Well, it's like everything else. If we had infinite money, yes, but we have a limited budget and we have an obligation to schools. We have a mental health crisis. We have a homelessness crisis, and we have to make sure that those immediate crises are dealt with. And I stand ready to work with the legislature if there is some suggestion on how to help local communities. I do, but if local communities don't want to raise their revenues to protect themselves, that, you kind of want local communities to take some responsibility for a local condition as well. So what I can say is this is a risk. We should be aware of it. We should put it in the proper prioritization of everything we have and move forward.
Up next, we'll
Go to Keith with Como. Go ahead, Keith.
Yeah, Governor, back to COVID. You had mentioned that New York and New Jersey are ahead in their curves, but California and Oregon, those governors have already made the decision and are giving firm dates to their citizens. Why don't you do the same for the citizens here to give them the assurance that you are going to indeed do this? What will you find out in a week that you don't already know today? Why not give them some dates today so there is some surety?
Well, because they may be better governors, but they're not governor of the best state. I'm the governor of the best state, which is Washington State. And we've made public health decisions that have led the nation repeatedly in saving thousands of lives, and we're going to continue on that. Now, in the information we'll have another week's data onto the rapidity and the rate of that decline. We're looking at that downhill slope. A lot of people are watching the downhill slopes in the Olympics. We're watching this downhill slope every day, and to see whether it will continue to confirm that we are in the same downhill slope as the rest of the international community. I think it is very highly likely that we will be, and we will know that next week, and I'll be able to make decisions that will allow this to be lifted in weeks rather than months, and which is largely consistent generally in the direction of California and Oregon, kind of what they're saying. By the way, I think you're inaccurate. I know that happens to all of us, but California has not made a decision, to my knowledge, about school masking, and so they have some uncertainty in their planning as well. So I'm the governor of Washington. I make decisions based on science and the health of our people, and I think we're doing a pretty darn good job of it.
Time for a couple more questions. Next one will go to Nicole with Cairo Radio. Go ahead, Nicole.
Good afternoon, Governor. Doctors with the State Hospital Association yesterday said that they think it's way too soon to safely lift the mask mandate, and they recommend doing that when cases are 100 per 100,000 residents. Right now, we're at 15 times that. So what is your response to them? And then additionally, some European countries have put kind of expiration dates on their vaccine cards. So without a booster, you wouldn't be considered fully vaccinated, for example, 9 months after your second dose. So at the moment, I could be at a restaurant sitting next to someone whose last shot was a year ago. I mean, when might we see updated regulations like that in Washington?
Well, we don't have a vaccination requirement for restaurants under state law. There are some counties that do. We do not have such a requirement today under state law. So it's kind of irrelevant, your question. I don't diminish the importance of your question, but we don't have that requirement. But you bring up a really, really important point, which is the value of a booster. And if I can take a moment to reiterate our encouragement of people who got the first shot or the first 2 shots. Man, there is no reason not to get the booster whatsoever, because the booster increases your protection. There is no question that you have better protection on your booster. For goodness sakes, why not get it? I talked to a friend the other day who's a very intelligent person, but he just didn't get around to it. Well, he got really, really sick. And the booster reduces the prospects of getting really, really sick. So I want to get as much encouragement as I can to get that booster. We've got maybe 55% of the eligible population of Washington who've had the booster. Man, it'd be great if the rest of those, half of those people protect themselves. Please protect yourself with the booster. Your first question, of course, promptly eluded me. What was your first question?
The State Hospital Association believes that we should only lift the mask mandate at 100 per 100,000. We're at 1,500 right now.
Yeah. Well, listen, I think there's a real chance for confusion here. I agree that today is not the day to lift the mask mandate. We don't want to say you can go maskless tomorrow. I agree with them. I agree with the CDC. I agree with Chris Rakedahl. And I think the media, to some degree, has not got the right message here. We're not eliminating it today, effective at 12 p.m. midnight. Nobody is suggesting that right now. What we are suggesting is to have a plan so that people can make their own decisions moving forward, and giving people as much forward knowledge of that as possible. And as I've indicated, I think based on the evidence we will have an extremely rapid decrease rate of hospitalizations. And I think there is every reason to believe that that's going to happen. We'd like to see another week's data to confirm that, but I'm very confident that that's going to happen. So we do get down to much lower levels that whoever you quoted there suggested. So I think there'll be a meeting of minds as we come down this slope.
Lacey, did you have something to add?
Yes, I do want to reinforce the point the governor made, which is we really are focused on hospital admissions beyond. We certainly are looking at cases because they are an indicator, but hospital admissions, we're looking at the severity of disease. We are fortunate in Washington state to have a high percent of people vaccinated. 80% of those eligible have received their vaccines. And we also are looking at what is on the horizon in terms of variants, and we certainly don't want to see, and at the moment we don't, a new variant that has cause for concern on the immediate horizon. Those things, in combination with health system capacity, will give us confidence that we can make some of these changes.
Yeah, I want to second what Lacey's saying here. The Omicron is considerably less lethal, but it still has the capacity to jam your hospital so nobody can get treatment for a heart attack. That's our major concern here. And what we're looking for is to get our hospital numbers down far enough to a level where they're not going to come back. In the intersection of those two lines, the capacity of our hospitals and the rate of hospitalizations, we're aiming for where those things cross is kind of the magic spot. And that's why we're looking at these graphs so carefully. It is hospitalization predominantly that we are looking at that are driving our decision making, in part because people have access to vaccines right now. Look, the vast majority of Washingtonians have an option right now to protect themselves. Get a vaccine, get a booster, and if you'd like, continue to wear a mask. So we have individual ways to protect ourselves. We need to protect the hospital system so that everybody can get treatment for heart attacks, car wrecks, and everything else.
Last question comes from Graham with Cairo. Go ahead, Graham.
Good afternoon, Governor. Are you considering the mask mandate for schools separately, or do you intend to remove all indoor mask mandates at the same time?
I think we will be doing both. I think it is likely that it would be at the same time, but we haven't totally made that decision. We'd like to give people as much of a sense of normalcy as is scientifically allowable. And we think doing that together probably makes the most sense.
Any final words, Governor?
No, I want to thank everybody. I think we are nearing a really good point in the state of Washington. And if we keep making decisions based on science, we're going to continue to keep people healthy. And I think we're on a very good route right now for some short-term improvement in our state. And I want to thank everybody who are pulling on the rope to get us to that point. It's coming very quickly. Thank you.